So welcome, Robert.
Thank you.
So you're going to have a Twinlight laser treatment today.
Yes.
And why have you decided to go for something like laser? What were you looking for with the treatment?
Well, I'm looking for some skin rejuvenation type thing because I can feel it aging. I've got some heavy wrinkling happening, and I'd like to try and ease a little bit of it.
Okay. So the Twinlight is an awesome treatment for your skin because you're going to get the different modes, which the doctor will explain while you're having the procedure. It boosts collagen, which will be good for the fine lines, but also you're going to get that peel, which will help with the pigment. So it's kind of everything in one. And you mentioned to me before that your son's wedding coming up.
Yes.
So we'll get a couple of treatments in before
I go, yes.
Before you go. So there'll be three monthly, one now and then one again in a month. Yeah. So what we're going to do now, because you've done your consent form, is to pop some numbing cream on you, and that'll stay on for an hour. And you can relax, and we'll get you a cup of tea, and then we'll go ahead with the treatment. Yeah.
Sounds perfect.
Does your face feel tingly or funny?
Yes, it does.
Yeah, so it feels a bit funny.
Yes,
so
feels
we're just
all
wiping
tingly.
off the cleansing.
So Robin, just to let you know, because you haven't had laser before, that there will be lots of noises because we're going to cover your eyes with some stickers to protect your eyes. You'll hear some beeping noises, you'll hear an exhaust fan, and probably the biggest thing with your eyes closed is that you're going to smell a smell that's like a burning smell. There's nothing to worry about, it's all normal.
Okay, lovely, thank you.
Okay, so this is the first bit of a Twinlight treatment. It's a 4-step treatment, and this first bit aims to induce very tiny micro burns under the surface of the skin, and that stimulates a process of inflammation and rejuvenation, new collagen formation, etc. And usually your patient won't feel anything during this step. Sometimes a little bit of heat, and that's it. Okay, Robin, you ready to go?
I'm fine. Go away.
So we're just airbrushing the laser over the face. It's firing quite rapidly, about 15 pulses per second. But this is a very gentle step, and you really don't feel too much. When I say micro burns, that sounds a bit dramatic, but it's just basically using heat to trigger an inflammatory response in the skin. Okay. So now we're going to do the second part of a Twinlight treatment for Robin. And the second part of the treatment is where we use the laser to heat each quadrant of the face or neck up in turn for 3 minutes between 37 and 41 degrees. So it will feel pretty warm. It will feel like you're standing quite close to a warm fire. Or some people describe it as feeling like a bit of hot wax being poured over the skin. So it's pretty hot, but it's not going to burn you. Okay? Fine. So yeah, what does that feel like then, Robin?
Exactly like I said, just like sitting in front of a warm fire.
Yeah, so pretty warm. Doing the temperature as we go. That's at 38, so that's at the target temperature. So we now time it for 3 minutes on this one area of the face before moving on to the next one. Yeah, so this mode of the laser is called piano mode, and it uses very long bursts of low energy laser which actually heats the water in the tissues, and that heating effect causes contraction of collagen fibres and therefore a skin tightening effect. So this is the step 3 of the Twinlight treatment, and we're going to be using the erbium laser now in a fractional or fractal mode, and what it does is it vaporizes very, very tiny little channels through the skin to stimulate deep skin rejuvenation and repair. So we're using an extractor here just to suck away any fumes or vapor, and Robin also has a cool air blower to use to blow on her face, which makes it a lot more comfortable for her. Okay.
Robin? Fine. Okay, good.
Okay, we're just going to do the final step of the Twinlight treatment now for Robin, and what we actually do here is a very light peel just to get rid of those damaged surface layers of skin. It's very light, it's a low downtime treatment this is. Robin's going to get a little bit of redness, a bit of dryness and peeling of the skin, but it's not an aggressive treatment and downtime is very, very limited. Okay, right, let's do it. Only of the, so we don't see anything too dramatic on the skin, just a little bit of white.
How's that feel, Robin?
Yeah, fine. Tingly, warm tingly.
Warm tingly, okay.
Yeah, so we've just finished the Twinlight treatment for Robin. This is immediately afterwards, so we can see that there's just that little bit of redness of the skin. But really that's about it. And she really didn't find that too bad, did you? Did you,
It was
Robin?
perfectly comfortable the whole way through. Yeah.
So now we're going to just cleanse the skin and get Robin a cup of tea, let her just relax for a little bit. We also put some special silicone gel onto the skin which stimulates accelerated healing and reduces any risk of infection or any complications, which would be incredibly uncommon. So thanks very much, Robin. That's great.
Thank you.
Hi, Robin.
Hi.
How was that? You've had your Twinlight now. How did it feel? Can you describe it?
It was fine. It felt a little bit warm and a little bit tingly, but
Yep.
definitely no pain whatsoever and no discomfort.
Okay, perfect. And so we've popped your Stratacell on the silicone cream and you've got that to go home with.
Yes.
And we've told you about protecting your skin from the sun,
Yes.
just using a gentle cleanser for a week.
Yes.
Yeah, so you've got your post-care form to go home with,
Yes.
and we'll give you a call tomorrow.
Okay, lovely. I'm so excited to see the end results.
Yeah, and we'll get you back. We'll make you an appointment for 4 to 6 weeks' time.
Perfect.
Thank you.
Thank you.